Please welcome Meredith Makeham.
Thank you, John, for those kind words, and I'd like to acknowledge the traditional custodians of the land on which we meet and elders past and present. Minister Lee, the Honourable Mr John Alexander, Dr Magda Campbell, Ms Lynelle Hales, and friends and Professor Patrick McNeill, and friends and colleagues from Sydney North Health Network and Macquarie University. It's a great pleasure to be asked to speak to you this evening. And my task is to officially welcome and congratulate the Sydney North Health Network as it embarks upon its important work on behalf of Macquarie University and the Australian Institute of Health Innovation. So welcome and congratulations. And what's not a task at all is to tell you how excited and delighted my colleagues and I at Macquarie University were when we discovered that you'd chosen our university as the location to have your party tonight. At this university, there are lots of dynamic things happening in the Faculty of Medicine and Health Sciences. I believe that we have an opportunity to do some great work together with your arrival for the benefit of clinicians and consumers of primary health care in the Northern Sydney region and beyond. Research and innovation is always the most meaningful and satisfying when it begins at home around us with people and systems that we really understand and care about. And when it's done at a high standard with academic rigour and carefully considered analysis, we can really hope to translate the things we discover for the benefit of the broader health community in Australia and the rest of the world. Our Dean Patrick McNeill is developing new programs at the university and enhancing the opportunities for primary healthcare in learning and teaching and research. The Australian Institute of Health Innovation is an organisation that was warmly welcomed to Macquarie University also about a year ago. And we're an organisation that's all about enhancing the delivery of quality, safe, efficient and affordable healthcare, with Professors Geoffrey Braithwaite, Joanna Westbrook and Enrico Cuira, who are leading some exceptional teams of researchers there. Our emphasis is on translational research and turning policy into practice. But in order to realise these types of aspirations and really reap the rewards of research, we need partners in the real world who share our goals. And I'm confident that we're on the same page with all of you at Sydney North Health Network in this respect. I've been lucky enough to have already had some hands-on experience in a research partnership this year with Sydney North Health Network. I'm leading a project called the GraceMed Study, which is examining the safety and quality of medicines across our region's residential aged care facilities and general practices. We've had great support from Sydney North Health Network in this project, and that's really enhanced clinicians and residential aged care facilities in taking part in this study. With their goodwill and involvement, we're really hoping to highlight the significant difference that exists in the data quality between the medicines data held for the same people at their residential aged care facility and in their general practices. So far, we've collected data from about 40 residential aged care facilities in the region. And significantly, in the first 100 patients whose records we've analysed, we've actually only found 2 people that had a match between those 2 locations. So look, as well as quantifying the extent of the problem, we're really interested in finding out more about the why this is going on. You know, getting the perspective of general practitioners and finding out more about what the barriers are to enhancing an improvement in that sort of quality and accuracy of data between those 2 locations. I'm really hoping that ultimately that's going to lead to improved safety and quality of care for those aged care residents in our region and hopefully elsewhere. And it will also have implications for the way we decide to manage data with our national health record. So I also want to say that it's fantastic to see so many other primary care clinicians here this evening with strong, valuable experience in primary care and also strong connections to the Sydney North Health Network. Professor Simon Wilcock is here this evening, and I was delighted when he joined the university earlier this year as our Director of Primary Care Services. He'll be leading the Clinical Council at Sydney North Health Network, and that's a group I've also joined, and we're really looking forward to the opportunity to work together and with other clinicians to support the board in its endeavours to achieve its goals. I think data quality is an area where primary care really has a lot of room for improvement. And you know, it's really important to get the perspective of clinicians so that we can understand where the gaps are and develop solutions that are practical and effective that will actually work in the real world. So I know that there's lots of other GPs and primary care clinicians here this evening. It's been lovely to catch up with so many of you. And I'm sure that you all share my feeling on the main reason why we all turn up at our practices. It's to care for our patients and improve their health. And many of us do that in quite small groups or even alone. Caring for people actually doesn't require a network. But really improving the health of the community is where networks are so important and can give us so much valuable help. When we ask questions of each other and share with each other and learn from each other and offer support to each other in networks like university research groups or great organisations like the Sydney North Health Network, that's when we take our ability to improve the health of the community to another level. I'm very proud to be part of the Sydney North Health Network and Macquarie University. And again, I'm delighted that you came to my place to have your party tonight. Thank you very much for inviting me to address you this evening.